Hello, hi everybody, hi everyone. Welcome on lesson 9 of Funerary Archaeology free course. Today we will focus on pathology, paleopathology. It's not, of course, all the subject and the matter about pathology. It's only a basic overview, since I believe that pathology is such a vast and big science and matter that it requires its own course. So keep in mind that the following pathologies are only a selection of what I choose to incorporate in this course. And they are very basic level, entry level, so everyone can easily follow. This course, I just remember you, is meant for everybody, no matter their level or their education. So it's just a very basic, fundamental introduction to the subject. So, if you hear and see me well, let me know. Hello, hi Alejandra. Hi everyone. Hi. Hi, hello everybody. Sorry for the little bit of delay, but I was having trouble with my computer, and so I was just a little bit late. So, I will say that it's time for start or no, okay? What happened? I'm searching my presentation. My screen froze. Do you hear me or see me well? Please let me know. Because I only see a frame of myself still frozen. Hello? Hello? Okay, everything is all right now. Okay, thank you. Okay, thank you. Everything is fine from my side too. So, shall we begin? So, lesson 9 is about pathology and the application of pathology to anthropological and archaeological remains, which is called paleopathology. What is pathology? It's the science which deals with the reconstruction of ancient population health and well-being. In simple words, is the study of ancient diseases. The evidence of pathology on skeletal remains can be uncertain because some diseases leave no observable traces on the bones. For instance, let's talk about and think about all the illnesses and diseases that we encounter during our life since the moment that we are born. For example, flus, I don't know, smallpox, and any other illnesses that are very common among children and young adults. Often they not show any alteration on bones because bones it's the very last step which is attacked and show the alteration of an illness, of a disease. Only long-term chronic diseases or congenital diseases, for example, people they are born with a bifid spine, for example. Metabolic diseases, some of them we have just covered yesterday. Just remember you the iron deficiencies, anemia, scurvy, and rickets are metabolic diseases. Cancer also, at very last stages, may be visible on the bones, on the skeleton, where the sign of the pathology, the morphological sign, are visible. A confirmation of its cause, it's not always certain, because since we are individuals and we are such a unique creation, we have a very different immune system from one another. So our immune system reacts differently to many illness, to many diseases. And also the bone has a very limited way to respond to pathology, to alteration. So it can happen that the same alteration could be referred to different pathology. And so, as you can see, there are many problems that pathologists have to face. And I think that pathology is a very hard subject and requires a lot of training done with material, fresh and dry material. I'm referring to bones, and fresh material could be useful for the one that study forensic studies. Also, we have to keep in mind when we are dealing with archaeological records and human remains that the so-called pseudo pathology could happen. Something that is may be confused with pathology, but it's not. Because when human remains, when a body is buried, is subjected to many factors. For instance, I don't know, the roots from adjoining trees can go in deep in the ground, find the tomb or the rest of it, the burial, and destroy completely the tomb, and so the bones, and will fragment and destruct it. Also, animals, scavengers animals, rodents can also erode and bite the flesh or the bones and leave teeth marks on the bones that can be mistaken for cut marks. Also, the grave goods, the elements and the object associated with the bones, with the one's body, could stain the skeletal remains. For example, metals. It's very common to find bones that have some sort of green bluish tint, which can totally be on the complete inheritance of the bone. Sorry. But also the chemical weathering of the soil could damage and erode the bones, and so on. Also, some people, when they are still living, are more robust than others, are more strong, and robust means strong in a muscular way. So this could change the appearance of the bones. For instance, it's very common to mistake the deltoid tuberosity, which is the muscle attachment of the deltoid muscle on the shaft of the humerus, for a healed fracture, because at the end, people with an higher level of robusticity happen to deform the humerus shaft. So, what are the most common pathologies that an archaeologist or anthropologist could encounter during an excavation, archaeological excavation? Well, the most detectable and the most common ones are trauma-induced alteration or injuries, such as fractures. Bones, when we are living, have a certain degree of elasticity, and that elasticity respond to forces that applies to them. So the bone can slightly bend before returning to its natural shape. But when the force is much higher than and greater than the elastic potential of the bone, it could lead to plastic deformation, so-called plastic deformation, and so fracture happened. So we can see a lot of schema with a lot of different type of fracture, horizontal, multiple, angulated, displaced, a rotation, so-called green leaf fracture, and so on. It's important to identify the moment of the alteration. If that alteration happened to the skeleton before that, and so it's referred to in archaeological literature, ante-mortem. After that, post-mortem, are a word derived from Latin, and close to the moment of death, perimortem. An ante-mortem injury will present a fully healed structure. As we saw yesterday, a fully healed alveolus in the jaw, when I was presenting to you teeth wear, teeth loss, and so on. Perimortem, which is close to the time of death, generally show no signs of healing. Ubelacker, which is a scholar, a very famous anthropologist, I believe is a forensic anthropologist, said that it's possible to see if a fracture happened perimortem, while it's possible to see that if a fracture happened postmortem. So it's easy to distinguish the both of them. If a fracture happened perimortem, the rim of the bone, of the piece of the bone, show a sort of a toothed edge, a sawback edge, and the bone is slightly bowed, because as I said before, as I mentioned before, in the living, there is the elasticity of the bone. If a fracture happened on dry bone, there is a clean edge and the bone stay flat. Also, perimortem, also postmortem fracture or injuries of any kind show a discoloration between the internal and the external bone. It's very common to, when during a digging, when during an excavation, that the archaeologist broke the skull, give a sort of blunt shaped injury, as we will see, just a blunt force trauma injury, sort of very circular indentation. but it's not. It was not an injury happened to the individual when he was living. It happened very frequently during excavation time, and it's easy to see. Of course, checking the edge of the fracture of the injury, but also to the color, because the external part of the cranial vault, it's much dirtier and darker rather than the internal part of the fracture, which in general is in a lighter color. If that type of incident happened sometimes after the moment of skeletonization of that, but still in ancient times and very early in time compared to us, it could happen that the internal color is still very close to the external color. So in that specific case, it's difficult to identify the moment in which that type of injury happened. Also, we have to remember that sometimes, for many reasons, the first one is linked to the immune system and the strength of a person. Sometimes a lesion or an injury of any kind could happen in partial obliteration. I'll zoom in partial closure. As you can see, it's not fully, completely healed. And the edges, the rim of the trauma, are smooth. So many times could happen that a person, let's say a warrior of a past society, is wounded, but passed sometimes to the moment of death. It doesn't. It didn't die right away, but sometimes it could die after weeks, months, sometimes even years. So we have to remember this. So, what about the fracture, the most common one? When a trauma happened to the bone, there is an immediate increase in vascularization, in blood flow, and the formation of callus, which is new bone material. You can see, sorry, okay, you can see here, this is a callus. All of these are callus, even this. But why all this picture of long bones and ribs have a different aspect, show a different morphology? Because when a fracture happened, normally, generally, it needs immobilization. Of course, you have to keep in place and stable, and the wounded part of the body don't have to move, but also you have to put these plate into pieces, if happen a simple fracture, as like this, in places. Because sometimes, given the force that could lead to a trauma, as we can see here and here, the piece of bone could slip, could move into its original, into the tissue, into let's say I don't know, of a limb, and need to be put in place. So if that action of putting in the correct position the elements of the bone is called reduction. So if reduction and immobilization, let's think about common and modern cast that usually it's used in the hospital nowadays. The perfect healing happened. But in the past, many times they didn't know that they have to reduct the bones. So when only the immobilization happened, the bones are placed in an incorrect position, and that could lead to a shortening, as we can see here, of the bones. A shortening and a torsion, an alteration of the anatomical position of the bone. Sometimes we have found many remains that show no sign of immobilization. Let's see from the rib cage, from ribs, because the deceased, I don't know, felt many pain, but they didn't know they have to keep very stable, didn't have to do any sort of a big movement and so on. So when no immobilization happened, we can see that the two parts of the fracture, of the fractured bone, remarginate themselves. There is a decalus right here and right here, but they are far away, just like in that case, and they will not fuse. So the pieces remain unfused. There are also other types of trauma that could happen in a sort of fracture and lesion during battle or war, or simply in a violent act. The head, it's a part of the living which is more subjected to most trauma. We can distinguish between different types of forced trauma based on the type of bone alteration, which is very easy to follow and to distinguish. There is the blunt force trauma, which give a sort of spheric, cylindric, circular injury. A sharp force trauma, which is thin and looking with a microscope could have a sort of triangular shape to it. It's usually the type of injury led by a sword or any type of blade, same as the slashing force trauma, which is similar to the sharp force trauma, but it's slightly different in the perimeter of the fracture and in the width of the fracture. And also we have the projectile force trauma, which is pretty much visible. It's very circular, but it, compared to the blunt force trauma, the projectile force trauma, since it's not something which is induced very close by from one person to another one, so the blunt force trauma only relies on the person's strength. The projectile force trauma is made by a gun or some sort of ancient, I don't know the English name, when they, sorry, I'll search it because I can't remember the English name. The sling, of course, it's the sling. With a sling and added to the human force, it has also the force of the projectile. The projectile impact to the bone. He'll lead a sort of crowned microfracture which surround the circular fracture due to the entrance of the projectile. Also, another type of trauma which is linked to the skull in ancient population could be cranial trappenation, when a piece of the skull it's removed manually with a manual drill, and it's removed. And that could happen in the ancient and past society for many reasons. The first one was to cure headache, and another one was to cure epilepsy. And if someone has some problem, some mental problem or personality problem, it could also be cured back then with cranial trappenation. And also when we find out example of cranial trappenation, as I said before, we can witness a partial closure of the injury. That means that the person who received the treatment survived for some times after the trepannation. Another pathology which is very common is the one that goes under the name of arthropathy, which is a group of pathological alteration that happen in the postcranial skeleton and in the intervertebral disc. Arthropathy increases with age. It's correlated to genetics, but also to biomechanical stress and activity. So it's based on an inflammation, a chronic inflammation of the articular or joint capsule and liquids, and that inflammation leads to the formation of new bones. So we happen to have an alteration of bone profile. As we see here, this is the knee joint. We can see that the part of the joint, the superior and inferior part, this is the femur, this is the tibia, show some sort of porosity, and if I zoom in, I can see right there this rim. It's all made of new bone. There is also a sort of degeneration, as we can see here, of the condyli, which happened because the liquid in the joint articulation is inflamed and it's thinning because of the inflammation. That sort of thinning could lead to the two parts of the adjoining bones to touch, and that specific action is called a bunion, a vernization that will present on the bone some sort of stripes, a very clear, lucid, shiny part of the bone, which could resemble ivory. We can see better here the vernization, the generation of the articulation, the part of the bone, and new bone material. Here we can see better the deposition of new bone material. You can see here it looks like a sort of new tissue which is glued together and fused together to the bone. And this happened for a defensive reason, because the bone see the inflammation as some sort of act of destroy, and so you have to defend itself with the formation of new bone. Also, when this formation of new bone is so much, it could lead into the so-called ankylosis, which is when two parts of a joint, two different bones, are fused together and so immobilized in that position by the formation of new bone tissue. Sometimes the formation of new bone, it's remarkable, as I said before, and can fuse together non-joining bones. And we have an example from rheumatoid arthritis. We can see the bones of the part of the hand and the wrist fused together, that part. And usually rheumatoid arthritis happen later in life, and the person which are the most involved with and attacked with it are usually female, and it's linked to genetics, and it's much more visible on foot and hand, because it deforms the hand and the foot of the living person. This is dish, the so-called dish, which is a pathology that happened in the vertebrae, in the spinal trait of our skeleton. DISH stands for diffuse idiopathic skeletal hyperostosis, and its origin is still debated, is still unknown. There is a lot of research toward it. Still, there is not a clear origin of it. Another type of pathology, it's the one related to chronic infection. The most common one is periostitis, which is the inflammation of the periosteum, which is that part of the cortical bone, which cover all the length in all the area of the bone, apart of the except of the joint. And the periostitis as a very unique type of trauma, of incidents in the bone. It could happen for many different reasons. As I was mentioning before, periostitis is one of that pathology that have different causes and could happen to have the same response of the bone. Could happen because of an infection, because of trauma, even because of cancer. And it's made of the sort of degeneration of the periosteum, so sort of microporosity. It's better so with a microscope. And a very, very bad form of periostitis, when the periostitis and inflammation and infection reach the medullary cavity, the very center of the bone, the living part of the bone, could happen in the osteomyelitis, which could lead to which could lead to a bone abscess, which is a perforation in the bone. That perforation is because the infection had created some materials that need to be put out of the body, and so it could happen into an abscess. But also the osteomyelitis could make the bone die, or a part of the bone die, and that the death of the bone is called necrosis. And sometimes the necrotic bone is enclosed into new bone tissue in a sort of band-aid, natural band-aid that keep the necrosis and the necrotic bone very limited from spreading, and that could leave many, many holes, and that sort of alteration and enlargement of new bone tissue. Also, another very peculiar infection disease, it's a long-term infection disease, which is called leprosy. It's caused by the bacteria Mycobacterium leprae. Usually that bacteria likes the cold, the area of our body which are the most cold, such as the nose area and the extremities, the hands and feet. And as you can see, it could happen into the fusion of this is an example of the foot bones, and into the complete erosion of the nasal aperture. And also you can see here a lot of periostitis on the orbital bone and cavity, even right there into the maxilla, into the part of the zygomatic arch, that part here. Another infection originated pathology is the syphilis. It's a very contagious sexually transmitted disease, could be transmitted sexually or even from mother to child through placenta. Then the alteration of the syphilis are very unique. It's a constant process of erosion and reparation, and the so-called osteolytic lesion, It could happen into the cranial vault. You can see here they have the shape of a button, and I think it's very painful from the living. And this is the very last stage. And syphilis is also called the great imitator because many times it's very, it depends, of course, on the stage of the disease. These are, for example, the very last stages. It could happen even many years. But during the early stages, if someone happen to die when the disease is on the early stages, it could show lesion that could be mistaken from another pathology. That bone here, they were once the bone of the lower part of the leg, the tibia, and it's a huge form of osteomyelitis of the tibia, and could have a sort of saber-shaped tibia. You can see that the osteolytic reaction is huge, and also there's a lot of porosity and cavities, holes. So it has to be very painful for the living person. And so, as I was mentioning before, that is only a very basic overview. That is only a very basic overview of what an archaeologist could encounter during field excavation when confronting human materials. Oh, sorry. I don't know. Sorry, but I hope it was not a problem, because when I share my PowerPoint presentation, I didn't see the rest of the screen. So I hope that message was not a problem. Please let me know. If there is something that you want to see again, please let me know. So I was saying that this is a basic overview. Of course, there are way lot more of pathologies, and I decided to include only these because they are the most characteristic one and also the most diffuse one. If there is anything that you wanna see again, please let me know, because I wasn't aware that the comment was still visible. So, and also I hope that the images that I found were clear. So there was no problem, I think. Okay. So if there is any question regarding some of the pathology that I mentioned, or anything. Oh. What if the holes in the skull are in the inside? Well, we see yesterday an example of this. which is anemia. Iron is linked to iron deficiency. Is one of the causes of the holes on the inside the skull. In that case, they're called cribria. Yes, it's relative, not an infection. It has also can be linked to an infection, but generally it's related to iron deficiency. So if there aren't any more questions, I will stop right there because it's a very long video. So people will say it again. Thank you. Also, if there is, I just repeat that if there are common bone alteration to other pathology that are not mentioned in that in that case, specific review and overview, and many of you have the interest of learning more about that specific pathology, could comment on the stream in classroom of that lesson of the course, and I will reply in more detail under the comment section, because I think it will be not in that way. It will be not confusing for newcomers of that specific video, because we'll keep everything related to that subject that I underline under that specific video. So thank you. Please feel free to ask everything under the comment section in Google Classroom, and we will see if there aren't any more questions. We will see each other next week on Thursday, and same time, I hope, if there is not any problem, because I am under renovation of my house. So if I need to change time accordingly to the work that they are doing in my house, I'll let you know on Classroom and social media. But finger crossed, I think that I will be able to be online around the same time as today. So I wish you all happy weekend. Please stay well, stay safe because of the current world situation. I will upload all the material of the lesson on Google Classroom. If you don't find any material of past lesson, keep in mind that is under reviewing. So when it's ready, it will be posted online for you to see. Also, there are a lot of refuses and grammatical mistake that I made, given that English is not my first language. So I need to review something. And also the people Save Cultural Heritage has to see that before you students do. And so be patient and check Google Classroom for new material. I wish you all good. Have a good time and see you next week. Bye-bye.